Hi, my name is Joshua Gray, and I'm going to be speaking to you, parents and fellow colleagues, about the possible ice hockey injuries, addressing any concerns and any type of considerations you might have or any hesitations you might have to allowing your kids to participate. As an athletic trainer, I can assure you that we are well trained in assessing, treating, and preventing many of these injuries. And as a qualified athletic trainer, I would like to reassure you that your kids are in good hands, and the following presentation should put you at ease. So, without further ado, we're going to address three of the major injuries in hockey. The first major injury are concussions. Secondary would be an MCL tear, which is a medial collateral tear of the ligament in the knee, and a herniated disc. Some of the environmental injuries or environmental factors that contribute to these type of injuries is the hard surface of the ice, the speed of the game, objects involved such as sticks, pucks, boards, goalposts, etc. To start in detail about concussions, that's the one that is getting the most headlines, so we should talk about that first. Concussion definition is a traumatic force caused by a bump, blow, or jolt to the head. It can also be caused by a force to the body, causing a resulting force being transmitted to the brain. These forces cause acceleration and deceleration of the brain as a result of rotational or direct force to the head. This is a picture of the worst case scenario. So I don't want any of you parents freaking out, but this is Max Pacioretty after he got hit along the bench where his head made contact with the post where the glass starts. And unfortunately, it's a pretty gruesome video. If anybody wants to check it out, it is on YouTube. But that is probably one of your fears as a parent. So I want to address how we can manage and treat and prevent this type of thing from happening. One method of injury, as we discussed, is that concussions happen at an alarming rate due to the speed of the sport and environmental factors like the ice, objects involved such as stray sticks or pucks, and the violent physical nature of the game, including body checks and the physical nature of hockey in general. One type of injury in hockey resulting in a concussion is a direct blow to the head. This direct blow will cause a rapid acceleration of force to the brain opposite of force being applied to the head. Another type of injury is due to an object that it hits the player. Lots of times a stray stick or a stray puck will fly and hit them in the head, causing some type of head injury. So it's something we need to be careful about as athletic trainers to make sure that we're always assessing, keeping a sharp eye on our players. Part of the anatomy of the concussion involves the tissue, bone, and joint. And the tissue involves the brain, which moves in opposition to the force being applied to it when there's a direct force to the head. This causes a massive force that the cerebral spinal fluid cannot absorb quickly enough. The cerebral spinal fluid acts as a shock absorber to the brain, creating a barrier in which the brain basically has a cushion against these violent blows. Cranial rotation occurs along the transverse plane at the cervical vertebra, and transverse rotation of the skull will cause rapid lateral movement of the atlas. As an athletic trainer, one of the assessment methods we use is a SCAT-2 test, which we will give to the player immediately following the injury, where we ask them a series of questions such as the time of day, the day of the week, their where they are at the moment, that sort of thing, to just get an idea of where they are mentally. If they are concussed, they will score it a certain way that will let us know that we need to look further and maybe possibly go with a different route as far as further medical attention. The assessment method, like I said, would be to give them the SCAT test to determine their cognitive function. All care is going to be taken to ensure the athlete's safety. So any suspicion of a concussion will be taken with extreme care and caution. We won't allow the athlete to participate until they're completely medically cleared. So it's always safer to err on the side of caution, especially with concussions. One method of treatment is rest. I cannot stress that one enough, that when the athlete is fully rested, then they can come back to compete once they're fully medically cleared. Antidepressants, such as amitriptyline and glutamate, which rebalances calcium level after the violent blow to the head, are all good means of treatment. There aren't too many other types of treatments out there other than just rest, which is really the best thing. Some of the rehabilitation and treatment exercises for concussed athletes include rest, like we said. Duration will be determined by the medical staff. A stepwise progression in light aerobic activity, 10 minutes a day, 3 times a week, is usually prescribed. We usually progress them to sport-specific activities after that for 30 minutes a day, 3 times a week. The next major injury that we see in hockey athletes is the MCL tear. Due to the MCL, or medial collateral ligament, it's due to its location, a valgus, or a force where the knee joint bends inward, occurs when there's tibia internal rotation, or the force is applied directly to the lateral side of the knee. This can result in a sprain or tear, depending on the severity of the injury. Some common types of method of injury or sprains or tears include catching your skate edge. So if the player's skate edge gets caught in a divot in the ice, their body weight will continue to go in a forward motion while their leg distal to the knee rotates internally, and that applies the excess force on the MCL. This can also occur due to a direct blow from a body check or a hip check to their lower body. This creates that valgus force to that lateral side of the knee, putting strain on the MCL. As far as the anatomy and assessment of the ACL, the tissue involved is evident by swelling and redness, especially in grade 2 and grade 3 sprains and tears. So we'll know the extent of it depending on how much swelling there is. As far as the bone structure, the tibial internal rotation and lateral femur external rotation are involved in the actual injury itself. This occurs at the knee joint, typically when it's in full extension and adducts, which is that valgus movement. The ligament involved is the tear of the MCL. It usually occurs distal to the femur and superior to the tibia, so right in between where the knee joint actually is. Tears often begin on the posterior side of the MCL, and full tears, or grade 3 tears, see the tear continue all the way to the anterior side of the MCL. This would be seen by an MRI. As we said, for an assessment method, immediately after the occurrence of the injury, assessment is needed immediately so that we can see, as trainers, the area before the swelling can begin. The use of a valgus test will gauge the stability of the joint. We'll see how much excess movement there is outside of a normal range of motion in the joint itself. We also use active and passive range of motion tests, and if we need to, we will send the athlete to get an MRI if we suspect it to be a grade 2 or greater tear. One of the methods of treatments for the MCL is to use the Rice method, usually done within the first 2 to 3 days of the time of injury. A posterior splint is also used to immobilize the joint after the initial time. If the tear is great enough, or any type of tear, there will be a lot of instability in the knee, so therefore we have to immobilize it to prevent further tears or further injury. As far as rehabilitation or treatment exercises, we start the rehabilitation exercises for the injured athlete as soon as possible following the injury. It's very important in recovery that the athlete regains their range of motion as soon as possible. One of the first exercises we implement is the isometric or straight leg lifts, where we'll hook up the athlete with electronic stimulation on their quadriceps. This will be done for 30 seconds on, 30 seconds off, 3 days a week, 3 times a week. Closed chain kinetic, which is usually done on a stationary bike, will be done 10 minutes a day, 3 days a week. And from there, we'll functionally progress them to their sport. And in this instance, a ball squat would be great. We'll usually do 3 sets per day, 10 reps per set, and 3 times a week. The third and final possible injury for a hockey player is a herniated disc. In definition, a herniated disc is the result of a tear or break in the annulus fibris in the vertebral disc. This causes the nucleus of the disc to protrude into the spinal cord region. This right here is the herniation itself. Lots of times the herniation will push against usually the sciatic if it's in the lumbar region, causing severe pain that goes from the buttocks all the way to the foot. Method of injury is chronic and prolonged poor body position, specifically in hockey, where you have excess forward flexion of the hips, causing strain on the lower lumbar region of the back, or a sudden impact, causing the body to fall or be compromised in an awkward position. As far as the anatomy assessment, the tissue involved is the annulus fibrosus tear, and the disc nucleus protrudes. The bone structure would be the flexion of the spine, causing compression of the anterior side of the vertebra. And the joint was excessive, like we said, forward flexion that causes protrusion of the disc posteriorly. The ligaments involved are tight hip flexors that can play a part due to the prolonged hip flexion that hockey players are typically in. To assess the herniated disc, the therapist or the athletic trainer, myself, will look for specific markers of pain, discomfort, and limited range of motion to give us a key as to what's going on. Sharp localized pain radiating from the glutes to the bilateral extremities, or just one extremity, are usually a case of a herniated disc in the L4, L5 region. Increase in pain with Valsalva maneuvers, such as a sneeze or a cough, are also common assessment triggers. Altered posture, where the athlete's body weight is shifted distally from the painful side, and they have unsteady gait. Some of the methods of treatment immediately following the injury is that we will use pain reduction modalities such as ice and electronic stimulation to improve blood flow, and also use ice to limit pain. We'll also use manual traction and backward bending of the spine, where we'll try to put the athlete's back into a proper position. Some rehabilitation and treatment exercises we'll implement is the cobra stretch. Often seen in yoga, this stretch will help to compress the spine posteriorly as opposed to anteriorly, and the opening of the vertebra in between will hopefully allow the spinal disc fluid to recede back into the vertebra, and therefore relieving the pressure on the nerve itself. This can be done 3 sets a day, 10-second holds at a time, 3 times a week. The second exercise would be the bird dog. This will help to strengthen the posterior chain muscles. Lots of times weak muscles either on posterior side or the core are responsible for many back injuries. This can be done for 3 sets a day, 10 reps per set, 3 times a week. The bird dog is going to be extending contralateral extremities. So you say you're lifting your left hand and your right leg at the same time while you're in kneeling and hand on the floor position. And you alternate back and forth, engaging the posterior muscles such as the glutes specifically. The third exercise would be planks. This is to strengthen your core. Again, core strength is ideal and necessary for proper back, and just it helps an overall athlete avoid back injuries in general. The 3 sets a day for 30-second holds to begin with, 60-second holds as the athlete progresses. We'll do this 3 times a week. These are the references we used. If you have any questions, you can feel free to reference these or ask me. If you have any follow-up questions, we'll be happy to help you in any way we can. Again, we want to let you know that hockey is a great sport. We encourage all athletes to participate in any kind of sport they feel comfortable with, but if your son or your daughter feel compelled to play hockey, we would really like to encourage them that if they are playing hockey and they're playing with us in our league, that they will be well taken care of, as we are all well-trained athletic trainers who are doing our very best to make sure that they have the best, healthiest outlook as far as a sport goes. Thank you.